Joined now by the Chairperson of the COVID-19 Ministerial Advisory Committee, Professor Salim Abdool Karim, talking all things coronavirus. Good evening, Professor. Thanks so much. Always such a great pleasure to talk to you. Very interesting, this excess deaths report. Now, we know that it's something that's looked at all across the world. Any cautions about us looking at this? It does seem quite alarming, but it suggests really that COVID is definitely having an impact on our death rate.
Yes, Sally, good evening. And when we look at what is being done across the world, they create an expected line. And that expected line is what you would expect historically. And then you calculate what is the excess deaths above that line. Now, the current report that you are quoting actually doesn't do that. It actually creates a separate arbitrary line that is much lower than the expected line based on some arbitrary feature which may or may not be accurate. So the correct way to do it is to calculate it over the excess, over the expected. If you're going to adjust that, we need to have some kind of explanation for that. So I think we can go on the basis that there's probably some underreporting and some overreporting of COVID, as you and I have previously discussed.
Yes,
and we would expect that the current number probably reflects some kind of undercount. The extent to which that undercount occurs is difficult to assess based on what this excess death calculation is, because it may be wrong, as Dr. Bradshaw pointed out.
Absolutely. One thing we know for sure is that cases are spiking. Gauteng is now the epicenter, and more of us are having contact with COVID-positive people. So the big question is when you should isolate. How much contact is enough to say, let me be careful and let me self-isolate? That's one question. And then the other one is, how long should we spend in isolation? I've been told by my doctor 10 days is sufficient, but I've heard 14 days, and should it be even less than that?
Yeah, so let's answer the first question. So how much of contact is adequate contact to be considered a contact? Generally, let's start with there's no number. There's no scientifically valid number. There's some assessment based on estimations with mathematical models and so on. And we, for simplicity, use 15 to 30 minutes. If you've got over 30 minutes of exposure, you should be considered a contact. If you've got between 15 and 30, that's a gray zone. And when you have less than 15 minutes of exposure, we would regard that as not adequate exposure. And it's, as I said, it's arbitrary, but we use it as a guide. With regard to how long should you self-isolate? So our current guideline is based on evidence that came quite early on in March and April, and we've chosen to go with 14. That was originally also a WHO recommendation. But new evidence is becoming available. There are now at least 3 studies that have looked at this issue, and essentially they show quite compellingly, in my view, that the individuals who have this disease, they would have viable virus for up to about 7 days. Beyond that, they may test positive on the PCR test, but do not have viable virus, and so therefore are not infectious. So we can say that, and that's what we are busy looking at, changing our guidelines. So at the moment it is 14, but we are looking to change it to 8 days of isolation. Now, there's a slight difference between isolation and quarantine. If somebody is exposed, they will then need to go into quarantine, and we are suggesting 5 days of quarantine while they are assessed for clinical symptoms. If they become feverish or they develop a cough, then they need to be tested. At the end of 5 days, if they are clear of symptoms, then they can go back to their normal activities. So 5 days for quarantine as a suspect if you have no symptoms, and 8 days of isolation if you have the infection.
So how do you know if you've got the infection if you don't have symptoms? And so when do you start your count?
Yeah, so we basically go from the date of exposure.
Okay.
So from the time of exposure, because we know that most people will develop their symptoms, if they're going to develop symptoms, within about 5 days. So that's why we based it on the evidence that's available currently of when symptoms develop following exposure.
It's really interesting because a lot of workplaces, including us here at ENCA, are looking at the platooning method where you do 7 days on, 7 days off. And that would also mean that in those 7 days, if you've been exposed, you would know you'd get through it and you'd be safe to return to the workplace. So it's certainly good news for keeping our economy going, and it gives some guidance to people who are just not sure. And as you say, information is coming out all the time. And this is, speaking of information, this week some concern about possible long-term brain damage, even from people who have the disease in a mild form. And we come to you because this information is coming out quickly, but as lay people we don't always know how to assess how serious it is. So I'm sure you've read the studies, University College of London among them. How concerned are you about possible long-term brain damage from COVID-19?
Yeah, it's very early data, and we are in science. We are hesitant to jump on just early data. We want some confirmation. If you look at what they have shown, is that there's a certain level of inflammatory changes, and with those come a swelling that occurs in the brain, and you get some kind of bleeding occasionally. In fact, it's like a mini stroke because it affects the small vessels, whereas a normal stroke would be a clot in a major vessel. So when we are seeing these patients and we're seeing these micro-occlusions and we're seeing these coagulation challenges in the small vessels of the brain, some of those changes will revert over time. As we know, stroke patients recover some of their activity after a while, but in some patients they may not. And so that's what they are pointing to, that there may be certain oxygen deficits as a result of the vasculitis, as a result of the coagulopathy, that may not get undone as we would hope over time. And it's a caution, and we would want to see a little bit more evidence before we start making any drastic changes.
All right, so no need to panic just yet is what I'm reading from your answer. I have to ask 2 quick final questions. I want to know how much the use of dexamethasone is helping in people who are really, really sick. And then I also want to know when the antibody tests are coming to South Africa.
Okay. So the first issue of dexamethasone, the guidance has been released, and it is already being used in many of our hospitals. It's widely available in South Africa, so that's not an issue because it's actually manufactured here in the injectable and in the oral form. It's too early to say what impact it's having on mortality, because actually mortality, or the case fatality rate, is a better way to look at it. The case fatality rate seems to be dropping everywhere, including in the US, including in South Africa. Our case fatality rates have steadily been inching downwards. We were above 2% at one point, and we are now well below that. Some of that is a function of the fact that we've got many more cases, but even if you adjust for that, our case fatality rates are declining. Dexamethasone may be contributing to some of that, but it's still early to tell. And then on the issue of, what was your second question?
It was about the antibody tests and when they're coming.
Right. So the antibody tests, the South African regulator, SAHPRA, is the body that releases and will approve tests. And they've been evaluating a whole range of different tests. Some of them are laboratory-based tests, and others are actually clinic-based tests. We do not have any home testing that we are looking at. It's only facility-based. You either get tested in a clinic or you get tested in a laboratory. The clinic is a very simple lateral flow assay. It's a bit like an HIV rapid test. You get the answer in a few minutes. And the first of those, I'm expecting, will either have already been released or are imminent in terms of being approved.
And that is certainly good news. Well, thank you very much for giving us the very latest on coronavirus. That was Professor Salim Abdool Karim speaking to us this Friday evening, and you heard it from him. The new thinking is, and he endorses it, 8 days if you actually do develop, 8 days after contact if you have developed the virus, 5 days if you've had contact but don't develop the virus. That's very interesting indeed.